Today's October 5th, 2018. We're here with Dr. Mary, who's a medical doctor, and you've been to our training sessions before.
I've been to 2 before this one. You think maybe you have learned everything you have to teach, but I learned so much more today. It's just a pleasure to be here. I think you injected my knee 3 years ago, and I only had that one injection.
One injection.
I've never had another problem, so it's awesome to have it happen to you. I do see it in my own patients, but it's amazing. It's always amazing.
Thank you. And I like this long-term 3-year follow-up. Thank you. And I like your endorsement of the workshop. Is it worth the money?
It is. It absolutely is. Thank you.
And you would tell others about this, yes?
Definitely.
Okay, thank you. I may put this on YouTube?
Sure.
Thank you very much, Mary. Today's date is October 5th, 2018. We're here with Dr. Tessa, a medical doctor from New Zealand, who's come all the way from New Zealand to learn ozone from us, and also she got a treatment today. Tessa, first of all, what did you think of your training and what you saw today in your one-on-one training?
I learned a lot. Thank you very much. You've taught me a lot, and I'm looking forward to being able to take it back to New Zealand, and I'm thinking of all the patients that have got all the different problems that now I know what to do with. I'm really excited about contacting them and saying, hey, guess what I can do?
What were your thoughts on what you actually saw today amongst my patients and your colleagues?
Well, I think ozone is a very great method. It's one of the big things for the future potential of keeping us healthy on this planet at this time when we have a lot of challenges.
Because you saw today a man's back get better instantly. Dr. Howard.
I did, and then he had a good pee afterwards
and
as well.
Had a good. That's right.
Yeah.
You shot his prostate and he peed afterwards.
That's right.
And then you saw a couple of your colleagues here get shoulder injections.
I did, and I had a hip injection myself, and I can feel it's a lot better.
Wow.
Yeah, straight away.
We did your left hip today as a demonstration, and on a scale of 10, how much pain did you have relieved?
Pretty much all of it.
Oh, wow. Okay. I'm really pleased.
So am I.
Thank you.
Thank
All
you.
Right. Well, I'm proud and honored that you came all the way from New Zealand, and I'd like to be able to post this on YouTube.
Thank you.
Is that
fine.
okay?
Yep.
Thank you very much.
How wealthy they are.
Dr. Tessa, you came a long way from New Zealand. Was it worth the cost for the seminar for you in terms of what you got?
Yes, it was.
No question.
No.
Thank you. Is it something you'd share with colleagues?
Definitely.
All right. Thanks. This is October 5th, 2018. We're here with Dr. James, who's from Phoenix, Arizona. You're a naturopath, and I'm honored to have you.
Thank you.
What's your reaction to today?
I was definitely surprised at the diversity of conditions you can treat with ozone, not just infections and things like that. I was definitely surprised by the prostate injection and how quickly it worked for the participant today. Yeah.
And how about other things you saw and other patients you saw? Any comments on that? Did that come as any surprise as to the effectiveness of this?
Not to me, because I've been watching your YouTube channel, but we definitely saw some quick results with shoulder issues, supraspinatus tendon, and so that was pretty impressive.
Was this worth it to come here?
Totally.
Worth the price?
Yeah.
Thank you very much. You'd recommend it to others?
Yes, definitely.
Thank you. I have your permission to put this on YouTube?
Yes.
Thank you. Well, today's date is August 6, 2018. It's the end of our 2-day workshop. This is Terry Grossman, an old-time alternative integrative doctor, an old-time friend of mine, and I finally got him here after years and years and years, and he's one of the best in the industry. I've loved him for years. And he finally came. I just want to ask you what you thought of the weekend here.
It was fabulous. My only regret is it's taken me so long to get here, and that was just unavoidable delays due to my schedule, because every time that I saw that there was a conference, I couldn't come. But now that I did have a free weekend, that I was in town when the conference was held, it was everything that I had hoped for in terms of teaching me what I need to know in order to do 10-pass ozone. I've done prolotherapy before, but now I know how to do it as prolotherapy with ozone, prolozone. And it was really a fabulous weekend with a lot of learning, some didactic training, and the opportunity with hands-on. So it was really everything that you could want in terms of you come for a weekend and you're able to go back on Monday, able to perform these therapies.
Would you recommend it to your colleagues?
Oh, absolutely. I don't think there could be anything better in terms of a treatment a program to learn these treatments. So I would wholeheartedly recommend that anybody's interested to add ozone therapy to their practice, that they come to see Dr. Rowan's course.
Thank you. Was it worth the price?
Oh, absolutely. Yeah, I think anybody will make the money back very, very quickly, just in terms of doing the treatments.
Thanks. And I hit you with that question by surprise because I want an honest reaction.
Yeah, no, there's the price is far less than the value. So as long as the price is inexpensive compared to the value of what you learn and the way you'll be able to help patients. So
Thank
no
you.
question at all.
Your thought about my short didactic lecture?
The lecture, actually, I'm kind of an egghead that way. So I liked it a lot. I would even like more, but there's only so much you can do in the course of a weekend. I think it's more valuable to, have your time spent, observing and practicing yourself. But the didactic section was absolutely of great value.
Thank you. May I post this on YouTube?
Oh, absolutely.
Thank you. And by the way, Dr. Grossman is from Colorado, and now you'll be on our list of trainees.
Thank you.
Thanks.
Thank you, Bob.
It's October 5th, 2018. We're at my ozone workshop with Dr. Olga, who's a dentist. Now, Olga, what was your perception of this class today from a dental professional viewpoint?
Well, I came to learn more about the Ozone for my TMJ patients, and so that I've gotten everything I needed for that, and way beyond, of course. And so some of the methods and techniques were eye-opening, and just can't wait to try it on my patients also.
Do you use kinesiology in your office now?
No, I always find it's difficult to decide whether a patient is testable or not, and I think now I have a little better understanding of that. Before it was always seemed to be so complicated. Now I think it's much more simplified and okay, might try to
Oh, good.
do that.
I know you came, you're a dentist. Did you get what you came for from a dental perspective?
Yes,
Good.
I knew what I was coming for, and I did get that.
And it was
for
worth
sure.
it to you then?
Yes. Mm-hmm.
Will you recommend it for other dentists?
Sure. It's depending on what they want to have and how they want to apply it. For what I needed, and for the type of patients that I have, that I got what I needed for sure.
Good, thank you. May I post this on YouTube?
Yes.
Thank you very much.
Thank you.
Today's date is October 6, 2018. We're here with Dr. Iris, who is a physician who came all the way to us from the Dominican Republic to learn ozone. Iris, what are your thoughts on the seminar this weekend?
It's the best. It's worth it. It's worth it.
It was worth it to fly all the way across the continent.
It's worth it to fly 8 hours and come here to learn. Yes. It was a really good course, and I learned a lot about ozone.
You would recommend it to others?
Yes, 110%.
I love you.
Yes.
Thank you. Worth the cost?
Excuse me?
Worth the money? The price?
Yes, more than that. It was.
It's worth more than what you paid.
Exactly. It's worth more than that I paid.
Thank you very much. And it means
It
a
was
lot.
a pleasure.
It means a lot coming from you, especially because you come from a different country and
Yes.
far from the United States. I'd like to post this on YouTube. May I do that?
Yes.
Thank you very
It's
much.
worth it.
Worth it.
I'm so happy.
Okay.
Yes.
Was it better than what you expected?
Oof. More than that.
More than
Yes.
that. Okay.
Yes.
Anything else you would like to tell the viewers?
You have to come. Learn about ozone. Ozone is life.
Okay.
Yes, that.
Thank you so much.
It's a pleasure.
Iris, I forgot to ask you, yesterday when I interviewed you, I forgot to mention we did your shoulder. I think we did your
Yes, this one.
supraspinatus tendon, and it was in a lot of pain before. Is that right?
Yes, exactly.
And we just treated you once. What's happened?
It's new. I have a new shoulder. I can do this. Even before, I made this and it was really painful here.
Mm-hmm.
Now I have no pain. No pain. It's a new one.
Great. Thank you very much. Today's date's October 6, 2018. We're here with Dr. Kathleen, who's from Northern California. You just attended our 2-day workshop. What were your thoughts? Did you like it?
Oh yeah, I enjoyed the workshop. There's a lot to learn. I felt like I got a lot of information to take back, and I'm excited about bringing the benefits that I've learned about to my patients.
And do you think you'll be able to do it?
Oh yeah, absolutely.
Okay, so you learned, the workshop did what it said.
Right. It had a lot of practical time where hands-on working, and that's really how I learn best. And I feel like I can go into my office now and do what I've learned.
Then we did what we advertised.
Yes.
Was it worth it?
Oh, absolutely.
Worth the price too?
Yes.
Thank you very much. I'd like to post this on YouTube. Is
Yes,
that okay?
that's
Thank
fine.
you. You also just had a 10 pass,
Right.
and it was difficult because of your veins, but we got it. You were saying how different you feel at this point.
Right. So I've been working too much, 12 to 15 hours a day, 5 to 6 days a week. I've been in my office, and I'm starting up. I've taken over practice. So I'm like working overtime, just trying to get everything organized and running smoothly. And I've been exhausted and not getting enough sleep. And I was really tired coming into this workshop. And I got the 10 pass, and about halfway through, I realized that my energy was much better. My head felt clearer. I felt lighter. So I'm very pleased.
Thank you. I'm sure people will be happy to know that too. Thank you very much. And this is something you'd refer to other health professionals, is it not?
Oh, yes.
Okay, great. What was that?
I'm hoping to get my husband to come here.
Oh, thanks. And he's a doctor. He's a medical doctor,
Yeah,
right?
he's a neuroradiologist.
Good. Wow. Then that speaks very highly if you want to get him to come to us.
Yeah.
Thank you. It's October 6th. It's the end of our workshop. This is Dr. Kwan, who's an anesthesiologist who came to learn ozone. Dr. Kwan, do you have what did you think of the workshop? Was it worth it for you?
The workshop is very valuable. I learned a lot of stuff. I already attend Dr. Schallenberger, and this time I attend Dr. Rowan. And I think Dr. Rowan have a lot of information that I have not learned in Dr. Schallenberger. For example, because the group is small, we have more interaction, and we get to stay closer and see the demonstration on the treatment. And then, fortunately, we get to try the use of 10 pass, which seemed to be a very, very powerful treatment.
So in terms of practical, this was a really good workshop in terms of the practical demonstrations and you doing it.
Yeah, absolutely.
Okay.
Yeah, absolutely.
Was it worth it?
It is worth every penny of it.
Worth every penny of it. Thank you. Thank you. It's an honor that you'd come, especially an anesthesiologist. You'd recommend this to other doctors?
I would definitely recommend it to everyone that believe in ozone, or at least try to believe in
Thanks.
ozone.
What did you think of the patients and the results that we got on our own doctors?
Oh, very good. Impressive. You get the result right away.
Yeah.
With very little local anesthetic. I'm a pain specialist, so
I know.
see how people being done, and the result here is remarkable. Especially, I think the most impressive one is the caudal epidural anesthesia that you are doing, because with the gas you can inject up, and it doesn't restrict by any pathway, and the people seem to be improved. And from what I heard from other people, it seemed to do a lot of work. So I'm going to try to take that back and do the caudal epidural ozone. I think that's the main way to treat all the so-called failback that I see them all the time.
It is really an honor that you said that. You're a pain specialist and an anesthesiologist. Mm-hmm. And to think that I could have taught you something and it was valuable to you, I'm honored. Thank you very much. I appreciate it. May I post this on YouTube?
Yes, sir.
Thank you very much.
Thank you.
I've already tested him, and we've determined by kinesiology he's got a problem in his back, and he's got a problem in his sacroiliac. So I just want to show this to you. And Terry, you'll get his face once when I do this, and you'll show how weak his leg is. Hold. All right, now to show his leg too, if you got his face once, get one. Look how easy this is. He's struggling. He's struggling. And this side, hold. He's struggling. And I have to put very little effort into that. All right? So you can stop it.
Well, what happens afterwards, and this is consistent each time, I feel level and grounded. I feel like my body is going stable with the floor on both sides, whereas before I absolutely did not feel that way.
How much
Far
pain-
better than a chiropractic adjustment, which makes me feel good.
On a scale of 10, you had pain when you walked in the door. How's your pain now?
Well, my pain is at 0. I wasn't feeling much discomfort earlier
Oh,
today,
okay.
which was good. Maybe I was at a 2. I don't notice 2 or 3. I played judo for 18
Okay.
years.
Can I post
But-
this on YouTube?
Absolutely.
Okay.
But now 0. It's